Hi guys, the Kriz here, MT, and welcome to another video. Sorry, medyo pangit yung boses ko ngayong gabi. Hindi naman nagbago pero kulang dry kasi nanggaling ako sa duty almost 36 hours and I had a presentation na kailangan kong fulfill kasi requirement siya for my 1 month rotation in toxicology. Sobrang saya and fulfilling na natapos ko siya, seeing that it is fairly a challenging rotation, no? Lalo na nasa Manila ako, malayo na naman ako sa comfort zone. Anyway, thank you for all those who helped, especially uh, the mentors and as well as my special someone, para lang laging binuboost ako morally and always giving me extra encouragements lagi sa aking araw-araw na sabak, okay, sa rotation or sa training. Hopefully, after this training, private practice na. Anyway, let's go to some news about health. No? Some news about health. Let's go back to the DOH website. Kasi you should always pick where the reliable sources are. Siyempre, the government DOH website is fairly updated from time to time. Kasi yung total tracker of COVID nandiyan pa rin. Hindi pa rin naman tayo tapos dyan eh. We also have other news about what type of health policies being implemented. Okay. Ito hindi na ito na-update. Matagal na to. And ito, okay. Yeah. Let's go fairly below. Kaya naman, November pa to last na update. I'm so sorry. Anyway, dito tayo sa events. So, dito kasi kami nagtitingin ng mga topics usually for that is fairly good to be concerned about kung ano yung gusto maganda natin pag-usapan together with the health topics of our kagawaran ng kalusugan. So, siguro next topics ko would be your universal healthcare, and then ear, nose, and throat consciousness week, National Emergency Preparedness Day. Yun, siguro daanan natin. Kasi nadaanan na natin yung AIDS, World AIDS Day. Actually, pwede pa ako magbigay ng isa pang video with regards to World AIDS Day. Kahit December 1 na siya. Kasi it's still needed to be discussed kasi di pa rin tayo lumalagpas sa pandemya ng HIV. Okay, it's been there ever since nung nag-boom siya noong 1980s. No? Ano pa ba? Well, yan yung tinitignan ko kapag tumitingin ako ng possible natin pag-usapan. Para lang din ma-engage tayo kung ano yung magandang pag-aralan, especially in health. Pero ito, here are the news. And these are not good. So, sabi ko nga, I'm here in Manila for training. And I've noticed that the hospital kung saan ako nagtitrain for 1 month already implemented wearing of mask inside the hospital again. Because still, high risk kasi. So, COVID beds in hospitals nearly full. DOH urges mask mandate for high-risk groups. High-risk groups. You should always remember your classifications. No? Are you high risk? Are you medium risk? Or low risk? Well, for an individual that is immunocompetent, meaning maganda ang resistensya mo, hindi ka madaling kabitan ng sakit, fully vaccinated, fully immunized, you're fairly low risk to easily be infected with any virus or per se COVID, diba? Okay? However, if let's say you are immunocompromised, your immune system is down because of a sickness that is currently you're being treated with, or you're not taking it seriously, or no, or if you have any ano to, medical condition like cancer, HIV, okay, or autoimmune disease na medyo dagda-down ang immune system mo because you're taking immunosuppressants para makontrol mo yung inflammation, those are considered high risk. Okay, high risk individuals. Now, kapag ganyan kasi, kapag high risk individuals ka, at saka meron pa rin tayong COVID, mas malaking concern yon. Lalo na kung ikaw yung high risk na hindi ka pa babakuna, no, or vaccine. Alam mo, meron pa rin may vaccine pa rin naman. The vaccines are screened, okay, for people, for the certain type of people. Okay, may mga type of vaccines na available for you, and you should always avail them. Okay, sayang naman kung hindi ka pa nagpapakuna. Now, ano ba yung concern dito according to the Middle Manila Standards? So, nung 15, I think that's 4 days ago, actually narinig ko din to from the area kung saan ako nagka-train, na there were already increasing number of beds. So, PCMC and KTI and the medical city has already noted that they're almost full in bed capacity for COVID. And the COVID beds are also being filled in other institutions, according to Undersecretary Tayag. Now, another concern is, well, kung alam nyo naman, the UPPGH has already implemented mask inside the facilities. Okay, kasi it's a huge mandate for us. And UPPGH is considered a catch basin for all diseases. Kung sakali, kung gusto nga nila, doon nila idaan lahat ng mga pasyente. Pero syempre, you have to triage them appropriately bago sila dumating at ma-accept sa UPPGH. So, implementation of mask has already been mandated. According to the DOH, yun nga, a total of 4 million COVID cases, in which 3,943 active cases currently. So that's still high. And a total of 66,000 died. That is from the entire pandemic, no? That is 3 years, spanning 2019, 2022. Kasi they declared that it's already done, no? Plus, ito, yung mga small pockets of cases that are still present. We still get COVID cases from time to time, pero not usually that much of a large amount of cases. Kasi, well, we're already having extra measures to avoid getting too much infection, okay, to being spread. Wearing mask, proper PPPEs, use of alcohol, no, and then proper hygiene. So it's important for us to still be vigilant with regards to our health. Pag nauubo, ganun, no? Especially those who are having travel or commute, wear your mask. Kasi pag may katabi kayo na pwedeng umubo, we will never know kung anong ubo yon. Ubo ba ng pneumonia? Ubo ba ng naninigarilyo? O ubo ba na may bahid ng COVID? Diba? So, you should always be careful. Anyway, so, ano ba ang kailangan natin malaman before we get too much overwhelmed with regards to respiratory illnesses? Actually, my mom messaged me or called me the other day Sabi niya, huwag kang magka-pneumonia. Apo. Top, yes ma. Kasi alam nila na these times, cold season is always a breeding ground for pneumonia. And you should always take care of yourself. Prevention is better than cure. Kasi prevention, you could work normally while being preventive, no? Doing preventive measures. While if you're being cured, you're already sick. You're at home, okay? Or you're in the hospital. Hindi ka makakagawa ng normal function mo. So would you be more on the preventive side, or would you be more on the curing phase? Siyempre, better to do prevention. Pero kung hindi mo na maiwasan at nagkasakit talaga, take care of yourself. Get cured. Okay? When you get cured and you feel better, follow the preventive measures. So, di ba? In the end, preventive pa rin ang papasukan mo. Now, for patients who are immunocompromised, yun nga, you should be the people who should be extra careful, especially for those na wala pang vaccines. Okay? Bakit natin hindi minabalik-balikan yung vaccine? Because vaccines, well, they elicit a extra layer of protection from you. Okay? Maganda nga ang pag-usapan natin of what are those protections that you have. You have a lot of barriers, It's not just your body, it is also a community-based barrier that you cannot see. Itong barrier na to, the first barrier that is usually being strengthened ever since we started vaccination is what you call herd immunity. So, what is herd immunity? Sa herd immunity, dali lang naman yan pag-usapan Let's say you're in a community of 50 individuals, and then your 50 individuals, 40 of them got vaccinated. 40 of them completed their doses. Yung 10 doon, I guess, kung yung 10 yon ay hindi na bakunahan, baka number 1, bata pa sila, hindi pa sila pwedeng makapag-receive ng vaccine. Kasi diba, there's a age limit for the COVID vaccine, especially sa petsa. Pangalawa, baka pwedeng immunocompromised nga sila. Kailangan muna nilang magpalakas before receiving the vaccine. And then, they had the previous reaction to the vaccine. Baka they're trying to identify a more better strain for them. Now, yung 10 yun, pwede ba sila pa rin maprotektahan? Yes. Kasi if the people around them are vaccinated, the ones you love, the people that care for you, the people you encounter, their immunity, will hold bearing as a external barrier from the outside. To protect you guys. Just as long as you don't get too exposed with people outside the community that would elicit exposure sa infection. So kung nandun ka lang sa community na 40 of them are vaccinated, you're relatively safe as long as you just stick with that community na bakunado. That goes to show kaya kailangan natin ng mass community vaccination, kasi if ever may mga people na hindi pa bakunado sa bahay, at least yung mga kakaulubilo niya ng mga tao bakunado, at least likely silang magkasakit. That's herd immunity. Now, we go to the human body. Pangalawa, the next is, what's the first line of defense? Well, that's your skin. That's your skin usually, di ba? Yun naman ang unang lagi nakikita, di ba? So if your skin is broken, easily pwede makapasok ang mga pathogens dyan. Now, what's next? Siyempre, your blood vessels. Your blood, I mean. Immune cells, WBCs, RBCs, leukocytes. Those act on cellular level na yan. So, they are non-specific, but they are very potent in your body. They usually are the cells that are important for early parts of cellular response. Now, the third line is your antibodies. Okay? Yung mga, from the cellular level, third line would be the more potent one that would elicit a longer effect of a immunity, which is your antibodies. These antibodies, okay, they target or they tag the pathogen or yung sakit na pumasok sa katawan mo, and they will be processed by your immune system through your T cells and your B cells to form a more potent immune response. Mas specific siya. And that is the backbone of your vaccines as well. Kasi once you are exposed to the vaccine, it acts as a template for your body to produce antibodies against the pathogen or yung sakit. That is more potent and long-lasting. Di katulad nung una, once nabutas mo na yung balat or na-penetrate yung balat, the next step na is cellular. For cellular, hindi siya specific. Pwede ka pa rin magkaroon ng inflammation sa mga normal tissues. Whereas yung antibodies, they target only yung pathogen itself. Okay? Medyo malalim yun na diskurso, pero dun kasi ang basihan natin ng protection sa katawan. Mainam natin malaman na kung nagkakaroon ka ng infection, kaya kapag let's say chickenpox na infection, once ka lang nagkaka-chickenpox, they say, di ba? Actually, pwede ka pang magkaroon, but that depends on the type of virus. Let's say yung sabi nila, once ka lang magkaka-chickenpox, after nun wala na. It's because once your body recognizes the infection, okay, once the body recognizes chickenpox, it will produce antibodies against chickenpox. And then later on, masusuppress niya na yung infection. Now, like chickenpox also can recur into the adult form. Pero hindi na siya yung kalat na kalat na bulutong or rash. It's more on a layered response. Okay, like a dermatoma layer, or parang mapapansin nyo yung sugat niya ay parang diretsong linya sa katawan. Pag ganun, you call it zoster or shingles. Now, yun naman, kapag nag-recur or nag-revert yung lakas nung virus, kailan bumabalik or yung lakas ng virus? Well, actually, hindi siya lumalakas. Ang nangyari dyan, humihina yung resistensya mo. Humihina yung immune response mo. Kaya bumabalik yung virus na nakatulog sa loob ng katawan mo. And that's usually the course of your zoster or herpes zoster. And kapag ganun ang nangyayari, kailangan din tayo, you should seek consult. Kasi pwede ka pa rin maging infective. Lalo na kung yung type of lesion is wet, and merong bahid yun ng ng virus, pwedeng mahawa yung mga bata at saka yung mga matatanda na kasama mo sa bahay. Okay? Kaya anong next best step? Kung may nagka-chickenpox sa bahay, okay, yung mga bata, dapat bigyan nyo na rin ng bakuna ng chickenpox para hindi masyadong malala yung sakit. Meron na rin tayong adult form ng herpes zoster na vaccine that can be available. You could just ask your doctors if there is availability sa locality nyo. And siyempre, heads up lang naman, meron din naman siyang price. Medyo din, bago kasi siya. So, relatively, it adds a better protection for you, lalo na sa mga herpes zoster. Now, so yun ang natin, ang goal natin for the immunity. That's why we need vaccines. And that's why we need to encourage our peeps community na hindi pa nakakapag second dose, booster, ganun. Pabakuna pa rin kayo. Libre pa rin naman ang bakuna, diba? And always ask your health centers if available pa ba yung vaccines. Sayang kung kasi napanis na yung bakuna, wala na. Okay, kung meron pang available dyan, pabakuna na. Okay? Sige. Medyo it's already 6 o'clock in the morning. Hanggang doon lang naman ang ko. Ang video ko for this morning. And tomorrow, I'll try to make another video. Siguro, pag-usapan natin tomorrow. Ano ba? Pag-usapan natin, I think diabetes is one thing that we can also talk about. Kasi, aside from hypertension, diabetes has a lot of story, a lot of backstory behind it. Kasi, anything can happen in DM. And anything with diabetes is somewhat very gruesome, lalo na kung hindi nagagamot. Like, pwede ka mabulag, pwede ka ma-stroke, pwede ka mag-end up to dialysis, kidney transplant, diba? Kapag hindi naagapan yung asukal correctly. Okay, hanggang doon lang yung video ko. And hopefully, na-enjoy nyo and may nakuha kayo konti sa aking munting 23 minutes of talking. Okay, this has been Doc Kriz, subscribe MD, and have a good day and see you in the next video. Subscribe, guys.